Many seniors spend their lives caring for others, but when it comes to their own mental health, too often they suffer in silence. According to the CDC, as many as 7 million Americans over 65 suffer from geriatric depression. Joining us to talk about how having a conversation is the first step to getting help and how genetic testing is helping seniors find treatment faster with even more confidence. Dr. Ranchero and his patient, Connie Thomas. First off, thank you both for joining us today.
Thank you.
Good morning, Michelle. Thank you for having us.
Of course, Dr. Ranchero. We'll start with you. Now, research shows millions of seniors struggle with mental health issues, yet many don't seek treatment. From your perspective, what are some of the biggest barriers, and why is talking about it the first step in breaking them down?
Well, first off, it's the recognition that as we age and mature, that it's not natural or it's not healthy that we isolate ourselves, that we withdraw, that we suffer from symptoms of depression, such as hopelessness, and realizing that that is not healthy and getting the help we need by talking to loved ones or talking to your primary care physician to start.
And Connie, did you find it a little hard to talk about your mental health? What ultimately encouraged you to open up?
No, I really didn't have a hard time with it. Back in 1987, I had breast cancer in January, and 6 months later, I had breast cancer on the other side, and I went through the surgery, and it's a very devastating surgery for a young person. And I had 3 children at home, and I was a single parent working, and then I wasn't able to work because of the surgeries. So it was a very hard time for me, and I knew I needed help. So I went to my doctor, and I explained what was going on, and he gave me some medication. And I was on that medication for a long time, the same one. And then I realized it wasn't working for me anymore. And I had just retired, and I had taken my grandchildren for 18 years to school every morning, and they're out of school and in college. I'm retired. And I don't have any reason to get up in the morning because what am I going to do all day since I don't work, don't have to take them to school? So I knew I needed help. So I went to my doctor, Dr. Ranchero, and he gave me the Genzyme test. And he found out what medication would be best for me. And I was being over-medicated. And he lowered the dose on my medication. And I have been a new person ever since he did that. And I have a lot more to look forward to and live for.
Boy, I love hearing that, Connie. Thank you so much for sharing that. And Dr. Ranchero, how does genetic testing help empower patients to have the talk with their doctors? And why is it especially valuable later in life?
You know what? A genetic test, it's 2025. We should have the ability to determine which medications are best for the patient based on their individual DNA, based on their genes. And that really helps the clinician along with the patient to say, hey, based on your genes, let's try this medication or these medications because this is the best interactions that they'll have. This is the best safety profile, the most tolerability. And then really, it's also important to get them on the right medication so they feel better faster, so they're not suffering for so long.
Connie, what would you say to other people out there like you who are experiencing mental health challenges?
Okay. I know a lot of elderly people that my age that are going through that, and I would talk to them as a friend. And then I would suggest that they go talk to their doctor and have the Genzyme test to see what, if it would help them and what medications a doctor could put them on. Because I had a family member that was going through a very bad, deep depression. And I talked to her and finally talked her into going to the doctor and getting help. And if she hadn't have done it, I don't know what would have happened to her, but she is altogether a different person today.
Boy, that is very powerful, Connie. Dr. Ranchero, where can we go for more information?
Thank you. You can go to genesight.com to get more information, and that way you can become an advocate for yourself or an advocate for your loved one.